In a world overrun with the fake, delusional, and disingenuous, he stands as a beacon of truth. He is Abuki Cabal. You are listening to Abuki Cabal.
What's happening, everybody? order from highest to low. The United States percent of the population with at least one dosage, that's the entire United States, is 16.3%. Total of the population with both dosages, and this is Moderna and Pfizer, is 8.4%. Okay? We're nowhere near what we need to be nationally. But let's go down to the states that we're talking about here. Let's look at where they are on the scale. Okay. They're at the bottom, as you can see. These are pretty much the worst states with regard to who's being vaccinated. Let's look at, and these numbers are yesterday's numbers, 3/4/21. So let's look at Texas. Everybody's been talking about Texas. Texas is at 14.2% of the population with at least one dosage, and 7.8% is fully vaccinated. Okay, let's look at Arkansas. Okay, Arkansas is doing a little bit better than Texas, which is, well, slightly better. 14.9% with at least one dosage. 8.3% fully vaccinated. Okay, let's look at Michigan. Michigan is doing a little bit better than Arkansas, 15.6% with at least one dosage, and 8.9% fully vaccinated of the total population now. Let's look at Mississippi. Where is Mississippi? Okay, Mississippi right up above Arkansas at 15%, less than Michigan. 8% fully vaccinated. Okay, to show you what that looks like from Mississippi's scales here. They got it on a little scale here, and this data is sourced by the CDC Vaccination Tracker, U.S. Census Data, State Public Dashboard. Okay, that's the percentage of the population of the residents given at least one dosage. I mean, on that meter, you see how small that is? It's ridiculous. Percentage of fully vaccinated, smaller. That's how Mississippi looks. Oh, those numbers. So, and this, I'm going to provide links to this to show you guys kind of where that is, you know. Something else I wanted to mention here. We can go down and we can look at the federal agencies. So you see the Bureau of Prisons is not giving any data at all. The Department of Defense is giving no data at all. Veterans Affairs, no data. Indian Health Services is higher than most of the states that want to lift the ban. So that, takes me into the next thing that I wanted to, kind of talk about, and that is that we still have a problem with, misinformation and the propaganda, from the last administration, from anti-vaxxers, people who are just have their own agendas with regard to trying to keep people from being vaccinated. And, this has been a huge problem. And I understand the free speech arguments, but this is akin to running into a theater and yelling fire. There are certain things that you just can't allow. And it seems like we as a society have some very difficult questions to ask of ourselves, and that is, what are we going to do when we're faced with, misinformation, propaganda that it basically is causing effects that will destroy the very foundations of our democracy and our way of life. We've also had, issues with, compliance across the board. We've got people who don't wear their mask properly now, nose out, wearing them as, chin bras, and just totally disregarding the efforts that have been recommended, and thus putting people at risk. I think there's been a lot of logistical failures, that lingered from, the last administration up to now. But there have been logistical victories as well. I mean, they're shipping more vaccines every day, but we're only at phase 2 of the immunization effort, which is basically, we are just now getting to the point to where we're immunizing people that are 65 and above, who are not in healthcare situations, not in nursing homes, not in the hospital for anything. So we haven't even gotten to people who are younger, children, teachers, the people who come out to your house and do your plumbing and do your electrical work. We want these things have to take place. We just had a major snowstorm here, and all these people are out. Plumbers are basically booked out weeks, maybe a month out, taking care of issues. These people have to be vaccinated. They got to come into your house. They have to interact with people. They're essentially frontline workers too. But we're leaving it up to their jobs to do this. And this is clearly not something that should be left up to people's employers to take care of. This is a national effort, and the states must fall in line with a national program to get everyone vaccinated and protected. I understand the concerns about vaccination, and I'm gonna put another article in the links as well. I'm gonna read a little something from an article from the Pew Research Trust, and it basically talks about where their focus is going to be with regard to people who are hesitant about taking the vaccine. But it says basically that the officials are concerned about vaccine hesitancy, especially in communities of color, where there are trust and education issues that can make a big difference in swaying people. The state officials are less focused on changing the minds of hardcore anti-vaxxers, a small but well-organized group of mostly white, educated, middle class people who oppose vaccinations on principle. They go on to say that their biggest focus is trying to monitor those groups to see what they're up to because of the harm their misinformation can do. It goes on to say that among most common forms of misinformation related to COVID-19 vaccines are anecdotal rumors, trying a person's untimely death to the fact that They recently got a COVID vaccine. Another myth that we see alleges that the vaccine can cause infertility and permanently alter a person's genetic code. All of these allegations are false. There's no information, there's no evidence to indicate any of these things, but we hear these things. I hear them all the time. I hear them with, coworkers, ancillary staff. I hear them, out in the Black community. And these people are unfortunately, they're just not educated. They're not, they're lay people. So, I can't expect them to really be privy to that information. And then we had people who were giving airtime. The media was giving airtime to this misinformation and helping to spread this misinformation. But then fact checking it and putting it alongside that and expecting the reader to have enough sense to basically work all of that out. I just don't think that was the right approach. I mean, we have PhDs out here who can't answer simple questions when posed by a man. Yet, I bet you if it was on an exam for that PhD, I bet you they could answer that question without adding all of that extra collateral, in every direction possibility of answer methodology that they use. So, I mean, we have to use common sense with this. They go on to state that they've been, widely criticized for, the states have been widely criticized for failing to collect race and ethnicity data on people who receive vaccinations. And as a result, it's unclear exactly what percentage of racial and ethnic populations are getting vaccinated. I dare to say that not very many. There's so many people that have been affected by this misinformation campaign that they just refuse to get vaccinated, and it's sad, and it is it's already taken a toll on our community. We have a duty to ourselves, our children and our communities, to educate ourselves, not with just any old thing that you can pick up. I mean, there are places where you can go to get this information. Go to the CDC's website. Go to research, the data for yourself. Don't let people go out here and tell you that you're gonna, grow an extra eye if you get this, this immunization. It just doesn't work that way. Most people don't, I mean, you talk about genetics, and most people can't even follow that. They don't know what RNA and deoxyribonucleic acid is. They don't know what that is. They don't know how it works. They don't even know how it works to form a human being. So, why would you give them information that's outside of their scope of understanding? It takes a little bit to understand this, and they should put this in the simplest form possible, but yet give them a venue that or an avenue to where they can have more information and scale up to understand it. So, going back to the article, they are working on efforts to obtain the data on racial and ethnic groups to better serve us. They're combining the existing data to try to determine race and ethnicity, to analyze how well we're doing and adjust accordingly. Basically, if we stay on target, we can beat this thing, and we've got to try to do that. In order to get where we, I want to go over this too. Even after you had the vaccine, I've seen people who basically just stop wearing the mask. They stop doing what they need to do, the social distancing, the masking. They just stop that, and they think that, well, I've got the immunization, so now I'm not gonna get it. That's not how it works. You still have to take precautions. You may get it, but it's not going to kill you. It will make the symptoms less severe than what they are without the vaccination. So what are we looking at if we follow the course that the current administration has to basically put us on track to handle the situation? So we have to get 80 to 90% of the United States population to be immunized in order to reach herd immunity. And that's either through prior infection or immunization. So once the state mandates are lifted, some people are going to choose not to wear a mask. I'm already hearing it here in my home state. I've talked to other people in some of the other surrounding states as well, and that's a concern, a major concern. The majority of people, like I said, have not been compliant with the mandate anyway, and it's been politically motivated by a person who was essentially a charlatan. This guy didn't know anything, I don't even want to go down that road. But he was vaccinated in secret. He and his wife were. He also received treatment for the vaccine that most of us won't get if we get it. The treatment initially was, you get it and, you're treated symptomatically. And if you get over it, yay. If you don't, you die. I mean, and even that, the reporting on the deaths prior to the election and the change in administration was so stratified that it basically made the numbers look smaller than what they are, and basically made it to where they questioned the deaths associated with this disease and tried to attribute them to these underlying medical conditions, these other comorbidities. But folks, it doesn't work that way. It does not work that way. You have people with cardiac problems who live full lives. You introduce COVID into that, and they could die today. Okay, so you can't say, oh, that was a cardiac issue. That was not a cardiac issue. That was a person who had cardiac issues who was basically killed by COVID. And that's what we're seeing. When you look at those numbers, they're not giving you the data that I see on a day-to-day basis. But if you were able to see that data, you would clearly be able to see that it's not just people dying of just normal causes. And a way to check that is basically you look at the increase of deaths, post the arrival of this virus. If you look at the number of deaths that you had before COVID, and you look at the number of deaths you have now, and then you look at the causes of death, and then, it's easy to see that, hey, we didn't have this many deaths before, but we had the same underlying conditions before. So what's changed? And all you have to do is inject into that data a massive worldwide virus. And it makes sense. I mean, it's not hard. I mean, it's logical thinking, guys. These states, these governors are raising these mandates, and there's nothing that says that, hey, it's time to raise this. And so, I'm just saying that guys, we got to look at this and ask ourselves, why is this necessary right now? What has changed that has made this necessary to do right now? And there's nothing. People are being immunized, but the levels in these states are still so low, and the daily numbers of infected and deaths are at the same levels that they were when we initially started doing closures. I mean, they're under, 1,000 people, but you're still looking at 800, 700, 500 new infections a day, which are adding to the people who are already sick and may not be over that. Oh, and not to mention that we've got multiple strains out here. The strain from Brazil, which if you go and research the deaths in Brazil, you'll see that they were pretty high. It took out quite a bit of its population, and people are still sick down there. And now it's here. Not only that, we've got the one out of England, which is also a very bad strain of this. It is a lot more infectious, and we're starting to see people who have had the first variant that are now coming down with the English variant. Also, these folks are getting the Brazilian variant. They have projections to show that the English variant will be the predominant strain in the United States pretty soon. So if we don't stay on course with this vaccination effort, that's going to be a problem. I mean, I think, they're trying to say that by reopening that, it's going to help out the businesses and the schools and whatnot. But I mean, if these people aren't vaccinated, we're putting these people in a situation where they could be infected, they could die. We have to ask ourselves, is it better that they're being, put in a position to where, okay, we lift the bans and we bow to political pressure and we open the businesses and the schools, and, basically pretty much casualties and, infections be damned. That's what these governors are saying. The plan is for total vaccination by May 2021. So it wasn't June, it was May. But I think after the Republicans went to CPAC, I think the plan was laid down, for these governors to basically, lift the bans, and when the surge comes, we're expecting a surge, by the way. Expecting the surge to happen right now, from some of the things that happened during, the snowstorm and whatnot. And then we're expecting a second surge after these bans are lifted. The mask mandates, not bans. So by lifting these mandates, it's inevitable that it's going to cause another surge in the infection rates. We've seen this before. It's happened at least twice before under the last administration. Again, we have to ask this question: why now? And why are these Republican governors, these red states, opening and lifting mandates now? So you're going to talk about people going into places who basically will not be taking precautions, and they're going to eat. They're going to sit all up next to each other. They're going to start socializing because, we've been locked down for so long. It's inevitable. Human behavior is going to override common sense. And I'm going to give a little prediction, with this. My prediction is that, they're going to cause another surge, and they're going to deny any responsibility in causing that surge. They're going to blame the surge on the current administration, call it a failure, and they're already giving them, a F on getting the kids back to school, and he hasn't even gotten his cabinet in. He he hasn't even gone through the normal things that a president will have to do to get to operational status. So there is an effort to basically put you out there and use you as a bargaining chip, use society as a bargaining chip for people's political motivations and benefit. And, I just want you guys to, basically protect yourselves, look out for your families, and look at this thing in a logical way. We all have to pitch in and do what's necessary to get this done. And that's all I'm asking. Please like and share and subscribe this. This is serious business, y'all. And I just felt like I had to try to do my part to try to help us out on this one. Thank you guys for listening.
Welcome to the Ibuki Cabal Show.
I feel like a motherless child.